Hey, this is Kevin Coyne reporting in from Abuja, Nigeria. I'm here at the venture platform facility, beautiful facility in Abuja. And I'm here with one of the entrepreneurs that works in this space. This is Dr. Sempa Danya. Tell us a little bit about your company. What are the problem and solution that you're working on, that you've developed?
So I basically founded Apmis, Health Management System. Apmis stands for the All-Purpose Medical Information System. The basic challenge that we're trying to solve is the fact that healthcare within the Nigerian space is inefficient, is fragmented, and obviously from that you get poor quality care as an output. So we're trying to change that by bringing technology into the space. And so with technology, we can bring efficiency, we can connect people faster and quicker, we can provide information at the right time, at the right place. And so ultimately, we then have better healthcare system and better healthcare outcomes as well.
Yeah, it's kind of interesting. It's like an electronic health record that's specifically built for the Nigerian market and the reality that's happening here. Now, you were saying something about that to deploy a new hospital. Tell us, what does it take?
So the interesting thing about our platform is that it works for almost all the stakeholders within the space. So whether it's a hospital, whether it's a pharmacy, whether it's a diagnostic center, whether it's an imaging center. So once you can get all these people to talk together on a single platform, then it's easy to provide care. So on the average, it costs about $250 for us to put our platform in each hospital. And what we're trying to do is provide this platform more or less free of charge to the hospital. We think that VMR and technology as a whole should be a revenue point for the hospital, not a cost center. Knowing already that they're operating in a resource constrained environment. So the goal is $250 in new hospitals rollout. We want to see this rolled out across at least 1,000 hospitals in Lagos, for instance, and then we can then grow across the country.
Got it. So, like looking at over 1,000 hospitals that are available, and a lot of times the profile is something that might look like a clinic. What are the challenges you've had to overcome in being in building this platform out? Because it's pretty impressive about what you're working on.
So I think that the first thing was the concept, right? Getting people to just accept the concept that you could actually have this platform and it can work and different institutions can collaborate together. I think that was the first one. And then second thing was getting us to work with the medical association, because we're not just going to each individual hospitals. There's already like an offline organization of this hospital. So we're just sitting on that and having that engagement with them and getting them to see the value in it. I think that's tremendous. The last one that we're about to cross now is the infrastructure challenge, which is getting in solar power to this, getting them devices, getting a network, in there. And once we can get those three things done, I think that rather than Nigeria being at the bottom of the ladder for healthcare, they'll become the top of the ladder and become somewhere people come in to see how did the system work, where can we replicate it as well. And the beauty of our system is that it's based in the cloud, so really it can work for the rest of the world.
Yeah,
as well.
so he's already got the software running. He's already got it deployed at a number of sites. More than 500 patients are already on the system. More than 30 healthcare providers are already inputting information to the system. So it's right at the point that it's taking off. Do you have a request that you'd like to make to anyone that might be listening?
Well, so my request is very simple. Sponsor a hospital in Nigeria. All it would take is just $250, and we can, put that there. Maybe put a flag, and say sponsored by you. And I think that's all that it takes to just get this going. We've done the hard work out there. It's just for them, adoption and scale. That's all we need.
Got it.
$250 a hospital.
Yeah, $250 a hospital to sponsor a hospital. And like you said, there's quite a lot of care that will happen. How many people would this see, just to give them a sense of how many people's lives?
So on the average, each hospital sees about 20 patients a day. So if you multiply that 25, that's 400. If you take that across 1 year, you're looking at almost 8,000, lives that will be affected, not counting children, in that space. So I think it's awesome to get this going out there and helping the physicians and helping everybody within the ecosystem coordinate care, improve their own work life. And one thing I should say here is that even though we look at the health industries in this country and say they are bad, the health workers are actually working end to end, right? So we need to put in technology there to make their life a little bit easier, and so they can, they can be more amenable, to providing better care to people.
That sounds great. Well, okay, we'll put a few of the details about how to follow up. Is there a best way for them to engage with you?
Oh, sure. So we have a website. It's www.apmis.ng. That's there, and then you can reach me up on Twitter, Simpadania, @Simpadania, and yeah, I think that's good to go.
I'll put that in the,
you could also look at the videos. So we have a YouTube channel. So all you just need to do is do www.apmis.videos with an S. It will take you to a playlist of the platform. So you can look at, various sections of the platform that we've already built out and give you an idea of how that is being utilized.
Sounds great. We'll put that into the notes around this video, and we'll go from there. Thank you all.
Thank you.